John?
Yeah. Hi.
Hi, John. I'm Dr. Brown. Nice to meet you.
Good to meet you.
Ready to come in?
Yeah.
Perfect.
Absolutely.
Right this way.
Thank you.
Have a seat on the couch and make yourself comfortable.
Thank you.
So before we get started with today's session, there's just a couple things I want to talk about with you to make sure I understand how I can best help you. Does that sound good?
Sure.
Alright, so every time you come into an individual session with me, you'll be asked to complete this form in the waiting room. When you check in, the receptionist will give it to you. We call it the ACORN. It gives me a snapshot view of how things have been going since the last time I saw you. It can also help us focus our session on things that are important to you. Does this kind of make sense?
Sure.
Okay, well another reason you're going to fill it out is so I can upload the information onto a secure website that turns your bubbled responses into data points on a graph, and it's really helpful because we can look at your progress over time and it can help determine what we're going to do with your counseling, if we need to keep it the same, if we need to make changes, or just stop counseling altogether. After you fill out these forms, I can show you your graph and we can see if this process is working. Does this make sense?
Sort of. But I mean, who can look me up? I really don't want my information out there for everyone.
That's totally understandable. I'll be looking it up on a regular basis, most of the time with you in my office. Your ID number at the bottom of the page is specific to this agency, so no outside people will know it belongs to you. So you don't need to worry about your information being out there. Is that okay?
Yeah, that sounds good.
Okay, so there's also no identifying information included in the system. We only collect your age, race, diagnosis, level of care, and education level to be able to compare you to the other people like you. I also want you to know that there's going to be sometimes I share your progress with my supervisor to show her how therapy is working and make sure I know exactly how to help you and take the best care possible.
So, what did you say about sending my information elsewhere? I mean, if only you and your manager need to see it, why do we have to send it somewhere? I don't want to be turned into a statistic.
No, and that's the last thing I'm trying to do. I enter your answers into a computer system that makes a graph that I can use personally to make sure that we're staying on the right track. This is just another way of looking at your answers you give me on the form to make sure I'm doing everything I can to help you. Each person is different, so if I notice a certain approach isn't working for you, I can change my strategy and just do what's best for you. The ACORN graph will just help us figure out if what we're doing is working or if we need to change some things.
Okay. And are you sure I'm supposed to be answering these questions about you? I mean, isn't this something that is supposed to be anonymous?
Those questions can't be anonymous because they're questions about our relationship. Your answers will help me make sure that we're on the right track with your therapy. We ask these questions because research has shown that when a client has felt that each session was helpful, they felt understood, and they were able to talk about things that were important to them, they got more benefit out of the therapy. Does this kind of make sense?
Yeah, but won't you be mad if I say something's bad?
No, not at all. In fact, I will thank you for being so honest with me. It's very important that you answer these questions honestly because I can't guess how you're feeling, so I need you to tell me if something's not working for you. I have found previously that people that have told me that something's not working or they don't like a certain thing, we're able to change it and they can get more out of therapy than the ones that always tell me that everything's perfect because there's just nothing we can work with. Also, my supervisor doesn't use your responses to evaluate me, so their main purpose is just to make sure you and I are on the right track and you're getting the most out of therapy.
Okay, can I answer just some of these questions?
You can answer how many questions you feel comfortable with. The more questions you answer, the more I can gather and start the graph, but I don't want to pressure you into anything and just want you to be comfortable with filling these out. I've noticed before that some of my clients fill out half of it, leave the other just empty, and through the sessions they are able to fill out some more. So you and I can just work together and hopefully by the end of everything you'll be filling out all the questions.
Okay, so who can see my answers again? And I mean, why do I have to do this so often?
Well, my supervisor and I are the only people who know your answers come from you because we're the only ones that know your ID number. And it may seem tedious, but I ask you to fill it out every time you come in because I really want to make sure we're on the right track. I don't want to waste your time, and having your responses to these questions each time will help me make sure that we're getting the most out of our time together. Does that make sense?
Yeah, absolutely. I mean, I don't want to waste our time either.
Okay, well, I really appreciate you filling this out. It helps me a lot. One last thing, when you're looking at the form and filling out the bubbles, make sure you completely darken. Don't put a mark in them. It's kind of like a standardized test or a voting sheet. Does that sound good?
Absolutely.
Okay, thanks.